It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Hello everyone, happy Wednesday. Welcome to this week's episode of Morton in the Morning. I'm your host, Julie, and we are broadcasting right here from Morton Hospital in Taunton, and we come to you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. It's certainly been very hot these past couple of days. We hope everyone has been staying cool inside and staying healthy. We have been posting some great tips on our Facebook page about staying well in the heat and what to do if you get a sunburn. So follow our Facebook page, facebook.com/Morton Hospital MA for some summer safety tips. Today we have a great show lined up for you. We always love to introduce our staff to our community. And many of you out there may already know the staff members that we've been interviewing today because they have a lot of interaction with our patients and they play a really critical role here in the hospital, and they are our interpreter services department. So we are looking forward to chatting with them about the care that they provide and the role that they play as part of our patient care team. So today we're happy to be joined by two special guests. We have Liliana Pavao, the Interpreter Services Manager here at Morton Hospital. And we also have Carla Fogaren, who is the System Director of Diversity, Equity, and Inclusion. Thank you both so much for being here.
Thank you for having us.
I'm excited about this show today so we can learn more about our Interpreter Services programming. So let's start by having each of you talk a bit about yourselves and your roles in the hospital, maybe a little bit about your background also.
I guess I'll start. My name is Carla Fogaren. I was born in Angola, Africa, raised in South Africa, and at the age of 12, we immigrated to the United States, to New Bedford, Massachusetts, of all places. Being Portuguese background, it was a perfect place to live because most of the city spoke Portuguese. So my parents are from Portugal. I decided to go to nursing school, and once I graduated from nursing school, I worked at a hospital called the Goddard Hospital in Stoughton, as we lovingly refer to as Stochigal, because there's so many Portuguese people there as well. And as a nurse that was bilingual, I was constantly being asked to, quote, interpret for people. Well, they would just assign me every Portuguese-speaking patient on the unit, which kept me very busy. So at that point, I just decided that, geez, we need to formalize this, and we need to create a department. So I did a business proposal to our chief nursing officer at the time, and voila, an interpreter services program staffed only by me at first, 24/7, exactly. And then I migrated from that to becoming the manager of interpreter services, and then the director, and then the system director. And in that role, I oversee 35 of our hospitals and all of the physician practices in helping them with language access. Disability. I'm also a certified disability coordinator for Steward, and I do all of the diversity trainings. So it's a great title, the Diversity, Equity, and Inclusion, because everything falls right under it.
Sure. So. All right, excellent. Well, it sounds like you wear a lot of hats, but that's for sure. Liliana, how about you?
So I'm the manager of the Interpreter Services at Morton Hospital. I've been with Morton for over 15 years. Our department provides qualified medical interpreters free of cost 24/7, as well as auxiliary aids. A little bit about myself. I grew up in Algarve, Portugal, before moving into Brockton at age 17. I am a Taunton resident, and besides English, I speak Portuguese, Spanish, and Cape Verdean.
Excellent. So I know, Carla, how you got into the field of medical interpreting, but how about you, Liliana?
So being an immigrant and having experienced firsthand language barriers was definitely a component. But when I started to work in a healthcare center, I really noticed how large of a demand we had. Even though I was not originally hired to be an interpreter, I would continuously get pulled from my primary job to be interpreting for the various providers. I got more and more intrigued about being a possible position and having to work as an interpreter. So I decided to learn a little bit more about the laws, the guidelines, education, and here I am today.
Okay, well, it sounds like you both fell into it in a very similar way. You recognized a need, and you figured out a way to meet that need. So wonderful. So here in Taunton, like New Bedford, is certainly a very diverse community. So can one of you talk a little bit about the diversity of this community and why having a robust interpreter services program is so important for that?
So the statistics will show that there's about 15% of the Taunton residents are born outside of the United States. And over the years, one thing's remained a constant factor. It's mostly a Portuguese community. Mm-hmm. But the Portuguese that settled here many, many years ago, eventually some of them learned English and their children learned English, etc. So now what we're seeing is, and Liliana, interject if I'm wrong, but we're seeing a Brazilian community, which is also Portuguese, but it's Brazilian Portuguese. We're seeing a Cape Verdean community. And in some cases, we're actually seeing little pockets of Haitians as well popping up, mm-hmm. which is not unusual because people tend to migrate from Boston and the more expensive cities to live in communities that are more welcoming mm-hmm. in some cases, sure. as far as socioeconomic. So have you noticed anything else in Taunton?
Yeah, so, like Carla did mention, our top languages are definitely Portuguese, having more diverted from the patient who came from Azores versus now more so the Brazilian. So Spanish is also a top language in Cape Verdean. American Sign Language, I would add to that, considering that, we do have the largest volume of deaf patients within our Steward system. So I would just add the American Sign Language to that.
Mm-hmm. That is so true. Out of the Massachusetts hospitals, absolutely, we see more patients who are deaf here in the Taunton community. And that could be because of your incredible resources mm-hmm. that are dedicated to meeting the needs of the deaf.
Sure.
You have Deaf Inc., you have other community organizations. So we're glad that they chose us as their hospital of choice. And we work really hard to try to make sure that for every patient, whether it's a spoken language or a patient who's deaf, that we provide the best quality care we can to them.
Okay, so based on the demographics of the community, there's certainly a need for our program. So talk about the various types of services that we offer here on site at the hospital.
So we obviously provide our own staff interpreters, so on site, and we also provide telephonic and video services. What we do is when a provider puts in a request for an interpreter, they may choose what modality works best for them. So also we've set up our services to always intercept first with our own interpreters and only when they're unavailable, okay. Because they may be serving another patient. Then the request actually goes immediately to the other vendor that we contracted with.
So the nice thing about this is that we have an incredible team of interpreters, mm-hmm. and obviously under Liliana's leadership, I don't have to worry about it because she does it all.
Sure.
But most people like in-person interpreters, mm-hmm. But sometimes that's just not possible due to the supply and demand. And some things might be as simple as trying to figure out if the patient wants a cup of tea or what they would like to order for their menu. Mm-hmm. So that can certainly be done by phone or even by video interpreting.
Okay.
So we have, bedside phones for the patients that they can use, that just by pressing a button, they can get an interpreter. We also provide probably 40 iPads here on stands in each of the departments, so that if they need an interpreter, like let's say it's for Cambodian or for Russian, mm-hmm. we can get a interpreter to appear on the screen.
Okay.
But the nice thing about that is, through Liliana's hard work as well, is that we've created our own video call center.
Great.
So what ends up happening is if you press Portuguese, it's going to route first to one of our interpreters that are sitting within the 9 hospitals in Massachusetts. So it could even be her own team. And it's so funny because the doctors are like, oh, are you working for the vendor? And it's no, we're working for you.
And
it's
they're on
within
video.
in-house, and they're
So
on
they
video.
recognize
So they
the
recognize our
interpreters.
interpreters. In addition to that, the same thing happens with the phone. If they dial the interpreter phone line, it is first goes to our office because we know that our interpreters can do the job very, very well because they know the community. They actually know the patient because they may have been interpreting for them 30 minutes before.
Right.
So that's been a real benefit to having a system-wide interpreter approach so that we kind of cover for each other.
Okay.
We don't have Russian interpreters here, but if you press Russian, you probably get the Russian interpreter at St. Elizabeth's to come up on the screen.
Okay.
And if they're tied up, it goes to the vendor, as Liliana said.
So the modalities are in person, telephone, and video.
Correct.
Okay. All right, well, we are going to pause here just to take a quick commercial break, but we'll be back for more with Carla and Liliana to learn about our interpreter services team here at Morton Hospital. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
If you're looking for weight loss that lasts, look no further than the Stewart Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back to Morton in the Morning. For today's show, we're sitting here with Liliana Pavao, the Interpreter Services Manager at Morton Hospital, as well as Carla Fogaren, the System Director of Diversity, Equity, and Inclusion, who also oversees all of the Interpreter Services departments across the Stewart healthcare system. So just to share some fun facts with our listeners that you had shared with me earlier about the interpreter program here at Morton. In fiscal year 2019, there were a total of 21,755 interpreter encounters here within the hospital, meaning our interpreters assisted patients or their loved ones that many times in 1 year. And out of that total, 85% of those encounters were done by our own on-site staff interpreters versus through the phone or over the video. So let's talk about the team that we have on site here at Morton Hospital. Who makes up that team and what languages do we speak on site?
So, we have a total of 8. There's 4 that speak Portuguese, Spanish, Cape Verdean. Then we have 3 that speak Portuguese and Spanish. In the community that we are in, it's very important that, we have the Portuguese and Spanish always on site, considering that these are our top languages. And then we are very lucky to have an American Sign Language interpreter. That's, we've had interpreters for American Sign Language for, I want to say at least about 10 years.
Okay.
We've had it for a very long time. And again, it's very helpful to have this diversity of languages because it's actually the same languages that are our top languages. So.
Okay. Great. And I can imagine that patients and families coming in, they must really appreciate that we offer all of these services. I can't imagine not being able to communicate in my own language with someone who's providing clinical care to me.
I think one of the most eye-opening things is during this COVID times is that, when we had restrictions on visitors because of COVID, that you're literally handing off your prized possession, your loved one, to someone that you cannot be involved in the discussion because you're not there.
Right.
And we got so many comments from community members, family members, and, just saying, but we know they're in good hands because we know that you have the team that you have out there. So a shout out to our interpreters. We have Karina, we have Ramona, we have Sonia, we have Lydia, and we have Sue, our ASL interpreter, and our new addition,
Eddie Lan,
Yep.
who, by the way, also speaks those top languages, Portuguese,
Excellent.
Spanish, and Cape Verdean.
Okay, so a wonderful team right here on site. That's very important. So if a patient comes into the hospital with a family member, what are the qualifications with regard to who can actually interpret for them, especially when it comes to, clinical communications, talking about treatment plans and giving medical advice?
So I'd like to take this one, and if you want to add, Liliana, I mean, it's extremely important for most of us that were the chameleons, the interpreters growing up in our families. We didn't have much choice. It's like, obviously, you brought me, Mom, because I speak English and you don't. But, from a legal perspective, there are laws that regulate this. There are regulations that regulate this. And every hospital in Massachusetts has to provide free interpreter services, as well as any physician practice or a health center. So if you come with your family member, do not be surprised if a provider has to ask the patient, do you want an interpreter, or, if the patient wants to use their son, they'll so say. And then we actually have to ask that with a qualified interpreter, because we want to make sure that the decision is the patient's. And oftentimes we hear from family members like sons and daughters that really do not want to be involved with the intimate details of their parents' health and clinical care. And, none of us sit at the kitchen table and say, hey, Ma, how was that cholecystectomy today? We just say, pass the chicken or whatever, or the kale soup or whatever it is that we eat at our table. So it takes a real level of proficiency in both languages. And then there's the third language of medicine that oftentimes gets ignored, but that is so important. We want to make sure that the patient and the family have complete understanding. So we do not encourage family members and friends to interpret for their loved ones. We would prefer to use the qualified medical interpreters that have hundreds and hundreds of hours of interpreting training and experience. And certainly we want you to be there in the role of the support person. Take some notes. Listen, because it's hard to listen and to interpret and retain things to bring home, discharge instructions, etc.
Right, especially during a difficult circumstance.
Absolutely.
Perhaps it's a negative or not so great diagnosis. I can't imagine having to relay that information to a loved one and being able to do so.
Yeah, because you're too emotional, right? I mean, at least, and you're using things like if the doctor or nurse, maybe the patient comes in and they're a little obese, no son or daughter wants to call their mother obese, at least, and live to get away with it for very long,
Yeah,
So
sure.
it's like, or the cancer diagnosis. In some of our cultures, you just don't ever do the C word because it takes away all of their hope, and only in many cultures it's so religious that only God can determine when you're going to go.
Yeah.
So we really want to make sure that we give every patient and family the opportunity to hear things, but hear it in a way that they can not only understand from a language but from a culture, because there's so many cultural variations.
Right, and so many complex medical terms that
Exactly.
it might be difficult to even understand for, most people.
Right.
And perhaps as a parent, you may have certain information that you don't want to disclose to your child.
Sure.
So you can be my child being 25 years old, you're still going to be my child. I wouldn't probably want to know a lot of the personal information.
Right.
But, these are the situations that we often come across.
Right. So what about staff members who speak other languages? Because again, we live in a diverse community. We have a lot of employees who speak additional languages such as Portuguese and Spanish. What guidelines or programs do you have in place to make sure that the right people are interpreting, knowing that many staff members can probably speak in general terms in those languages?
So, the key word, and I know you did this intentfully because, is that you use the word the right staff can interpret, because many bilingual people, clinical staff, think that they can interpret. And the only people that can actually interpret are our interpreter services.
Okay.
Whether it's in person, by phone, or by video. So there's a federal law called Section 1557 that in October of 2016 came out, and it basically says that somebody like me, who happens to be a Portuguese-speaking RN, can no longer communicate clinically directly to my Portuguese-speaking 82-year-old lady that's right in front of me, unless this hospital has assessed me and found me to be competent. Not in speaking Portuguese. I want to be really clear about that,
Sure.
because no one would argue that the person probably speaks Portuguese, is culturally Portuguese, goes to the Portuguese Mass. We're talking about the clinical proficiency needed to speak at a medical level at such a good proficiency that the patient is not losing out in the conversation. We want to make sure that whatever an English speaker hears or gets, a Portuguese speaker hears. So here we have an assessment called the Bilingual Clinical Staff Language Assessment. Liliana actually administers it. It's a audio recorded session. All of our providers that want to take it. And if they pass, and they have to pass with a 90. So we want it to be the best. We wanted a person taking care of you at all times.
Excellent. So I also understand that the interpreter services departments at each of the hospitals oversee ADA compliance. So talk about the different services or equipment that we have available here at the hospital to support patients who have various disabilities.
So I became the American with Disabilities Coordinator. I had to go through a certification, a national certification for it, because it really was something that stretched my mind. I really wasn't an expert on it. So what we have a responsibility to do is provide what Liliana mentioned earlier, something called auxiliary aids, which are things that people with disabilities may need. Some of them don't even realize that the hospitals are mandated to really provide it, but we've done so proactively. As you come into our facility, you'll actually see a sign with all of the auxiliary aids that we have available. It's done in Braille as well, but we have things like magnification lenses for people who are low vision. We have amplifiers for people who have a hard of hearing. Sometimes, going louder and slower does not make you hear any better. We have whiteboards. We have a video phone, which is an iPad, where if you're deaf and you want to communicate with your deaf husband or spouse, you can call and you can sign to each other. We have a TTY phone, which is a texting phone. We also have amplified phones, and also phones that are special for hearing aid, people who are wearing hearing aids. So at any point, either the patient can request these or the staff can. The interpreter services have actually been trained. They go upstairs or wherever. They assess the patient to make sure that this request actually will meet the patient's needs.
Okay.
And then we give it to the patient to use while they're here.
Okay, wonderful. So two of the newer programs that have been implemented here at the hospital. One you touched on slightly, which is the video center, the video call center. And the other is a new inbound calling program for patients who are calling the hospital that do not speak English. Can you go a little bit further in depth about those and how they work?
Sure. So when you call our Morton Hospital main number, you'll be prompted to continue the call in another language.
Okay.
And we are offering those, obviously, in our top languages. So you'll say, if you speak Portuguese, press 1. If you speak English, please press 2. And then you'll provide the callback number, and an interpreter speaking that language will call you momentarily. So that way, the call will not be unintended. We'll make sure that we'll be able to get a hold of the caller and follow up back on their original request.
If I can add a little bit, so you call in and it says press 1 for English, and then press 2 for Portuguese, press 3 for Spanish, etc. And of course, all of our different hospitals have different languages that they offer. But the great thing about that is, like, literally, you put in your callback number, and an interpreter in under 10 minutes usually calls you right back where you are. What kind of service is that? That is a wonderful thing, because if I'm struggling and I can't speak English and I want to check on my loved one in the hospital, I don't want to wait for my teenage daughter to get home from school to be able to interpret for me.
Right.
It just gives me so much more control, and we felt strongly that our community, the Stewart community, deserved that and more.
Absolutely.
We actually had such success here in Massachusetts that we just implemented it nationwide.
Oh, wonderful.
And hopefully soon we'll do it at our physician practices. So if a patient wants to call in their blood sugar, they can go ahead and call in their blood sugar directly versus having to wait for someone else to be able to help them.
Okay. Well, that's an incredible service. How about assisting with, making appointments? Is that something you do through that line as well?
That's correct. So just to Carla's point, imagine if you call and then you get transferred to interpreter services. I may not be in the office or ready to receive your call. And, if you need to set up an appointment, or if you need to acknowledge that you're going to be late, can I reschedule that appointment? Leaving a voicemail message on my phone, I'll probably get back to you after I get back in the office, which could be after that appointment time. So this is all in order to, facilitate with the communication. So the moment we get that call, we'll be able to reach out to the patient, reach out then, making sure we can connect with the scheduling department and arrange for appointments. So this can all be done via the phone.
Okay, that's great. And that pops up automatically if you call the main hospital number, correct?
That's it.
It does. And then just for those that are out there that are doing all this telehealth, you hear the word telehealth and you go, what is that? Well, due to COVID, as you know, a lot of physician practices have gone to virtual calls, either through video or phone. Well, please do not worry about the fact, because an interpreter can be added to those. And if the physicians need it, or the nurse practitioners, or anybody needs an interpreter to be added to the calls, they certainly will. And if you want to reach your physician's practice, you can feel free to call the main number and we'll help you as much as we can, because we know that these are extenuating circumstances right now.
Well, this has been great information so far. Thank you so much, Carla and Liliana. But we're not done yet. We're going to come back with more with you and talk a little bit more about the services that you provide. We're about at the halfway mark of today's show, so it's time for another commercial break. Stay with us and we'll be right back after these messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Welcome back to Morton in the Morning. Thanks for joining us for today's show. We are excited to be here today talking about the Interpreter Services Program at Morton Hospital and some of the diversity and inclusion initiatives that are happening. Right now, we're sitting here with Carla and Liliana, and we've been talking about the various services offered at the hospital, the various laws and regulations that are in place with regard to who can interpret for patients. And does our department here, do you provide interpreter services to provider offices, or do they ultimately provide their own services and you really just give them some resources?
So that's correct. We, our services that we have is for our hospital and for the offsites locations that we are responsible for.
Yep, our hospital
However,
departments.
that's correct. So, however, if there's a doctor's office that's unsure as to how to go about, we can provide them with resources, but ultimately they'll be the ones responsible for arranging with their own interpreter services.
Excellent.
I mean, every physician practice, CVS, nursing home, ambulatory care center is responsible for providing these.
Mm-hmm.
What people do is they struggle, though, because we've been doing this for so long at the hospital level that some of these single practice physicians are really struggling. So whether they're Steward Medical Group, but by the way, Steward Medical Group, they all have access to interpreter services by phone and some of them by video. So we've already done that work. But if it's an affiliated doc or some doc in the community, please don't hesitate to give us a call. If we can point you in the right direction and say, well, here's tons of vendors, you choose who you want to call, but this is what we would, suggest to you. Sometimes they just need that starting point. They want to do the right thing. They just don't know how to do it.
Yep,
Yeah,
absolutely.
and being part of the community, again, these are the patients that most likely are going to be coming back to us, going back to them. Ensuring that good communication and effective communication is available is the goal. So why not, right?
Okay.
Facilitate.
Yep, absolutely. And just curious, is there anything new or unique in the field of interpreter services, or are you planning to implement any new programs to the departments in the future?
Well, there is one new goal that I have for this year coming up. I'd like to have our phone call center also be expanded so that an interpreter at any of our hospitals can answer the call. because this will really help us. Like, our steward interpreters know the steward system, they know the patients, they know what we do.
Right.
They have experience in genetic counseling, they have experience in maternity, in several areas, like, pediatrics, and we know what we've got with our pool. So we're hoping to do that, but we're really trying to expand it more as well into the diversity field. Mm-hmm. So we know that language and culture are very closely connected. However, there are huge disparities still happening.
Sure.
So we're hoping to also be able to provide that lens so that people can say, aha, it's not just the language, it's not just the culture, but it's how I respond to that. Because cultural competence is not a good word for me, because it means that someday I'll be competent. And I'm never going to be competent. There are 7,000 languages in the world, so many different cultures. But what I can be is more culturally responsive to your needs.
Yeah. So it sounds like you have some incredible resources available to our patients, to families, and even to the community at large. There's a lot to know about what you have to offer. I would imagine you have to do a lot of education with all the staff and providers throughout the year. Is that correct?
Yes, that's correct. But, to be honest, we do real-time education every day. So if I see something that needs to be addressed at that particular moment, then we'll handle it at that moment. So this will be on a typical day. But we also participate in the hospital Skills Day events. We present at various staff meetings yearly. We make sure that we target that. Culturally connection newsletters to all users. New employee orientations, also nursing orientations.
Okay, so you present anytime a new employee starts, you provide education about what's available.
That's correct.
Okay.
So we go over and we make sure that we don't just talk about the equipment and the services we provide, but we also ensure that we go over the laws, and because it's very important that a new employee that comes on board understands the process that we follow, the policies. And we want to make sure that that individual feels free to always approach me should they have a question or any kind of concern. We work together.
Okay.
And that's basically the leadership here at Morton, with Heidi and the rest of you. Being a corporate person, right? I don't sit here every day, but it's a pleasure working with a hospital like this that, if I have any concerns at all, I just reach out to you, Julie, or I reach out to Heidi, the president, and within minutes I have a response. I mean, this is not something that is just a check off the box mentality.
Right.
I honestly feel that this is the culture of Morton.
Yeah, it's really important. I mean, it's directly associated with patient safety, which is obviously our number one priority.
Right.
I mean, communication is such a huge piece of that. So this is certainly a priority for us, making sure that we have all of the resources to assist our patients, to make sure they can be communicated, with and among our team members, and really understand their care.
True. And I think we do a great job with everybody's input here. We get calls all the time about, do you think we should do this, or we should try this? And it's great that you're not sitting in your office by yourself feeling like you're the only person thinking about it.
So as we wrap up our time with you both, is there anything else you'd like the community to know about the services here, the team here, just anything in general?
We'll always be here to facilitate and be sure to offer our services for effective communication. We're very pleased to be here, and let us know how can we help you.
And I think I would only add, it's the good, the bad, and the ugly. I always say, we hear so many good things, and sometimes people hesitate in letting us know that perhaps there's an area that we could improve on. And I really, really, really welcome that. I want you to let us know, because sometimes we may just not be aware. Once we become aware, we can fix things, we can move in the right direction. So if there's anything that we could do to make your experience here at Morton better, or your families, please let us know. We want to be your hospital of choice, and we look forward to serving the whole diversity of this community. And it's quite the diverse community here in the greater Taunton area.
Excellent. One more thing for each of you. What is your favorite thing about the role that you play or the work that you do?
Is that every day is different, but it's always gratifying.
Excellent.
I would say the same, and I think from a person that's more on the administrative side in the corporate world, I think that a lot of my colleagues sometimes struggle with the day-to-day business stuff, and yet I get this really guilty pleasure of seeing how we're impacting people's lives, not just like on paper somewhere on a plan, but how it actually makes a difference, not just for the provider, but for the patient and their family. So I think, again, it's that gratification, that reward. It just keeps fueling us.
Yes.
It's like even when we're exhausted, it just keeps fueling us to want to be doing more and doing better.
Yeah, well, we certainly have an amazing team here. Their passion for what they do is so evident. We get so many comments all the time from patients who just love our interpreter services team. Again, some amazing resources available for our community, great care you're providing every day to our patients. So thank you very much. This has been really, really helpful. And again, if anyone has any questions about the interpreter services that we offer, you can check it out on our website, mortonhospital.org. There's information there. But just call our main number and ask for the interpreter services team. Someone will be happy to speak with you. So I just want to thank you both so much for your time. This has been very helpful today.
Thank you for
Our
having
pleasure.
us.
Thank you.
Okay, and hopefully we'll talk to you again soon.
You bet.
All right, well, that wraps up the interview portion of today's show. We again want to thank Liliana and Carla for joining us today. It was a pleasure speaking with them and hearing about the very important work that they and the members of their interpreter services team do here at Morton Hospital to ensure that every patient coming into the hospital, regardless of their background, their language, their culture, that they feel comfortable and that they can communicate with our providers and understand their care. So such a great team. Thank you again for telling us about all of these services available right here at Morton Hospital. So we are coming to our last break of today's show. Before we do, I want to remind our listeners about how you can contact us here at Morton Hospital. We would love to hear from our listeners, so you can email us. We have a special email address set up, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. Now you can email us if you have any feedback about our shows, if you have any, follow-up questions or questions you'd like us to answer on air, or if you have any ideas for topics that you'd like to hear about on future shows, we'd be happy to consider those. So email us at any time, mortoninthemorning@steward.org, and we will be checking that email regularly throughout the week, and we look forward to hearing from you. So it is time for our final break of today's show. When we come back, I have a few hospital updates to share, including some exciting news about a contest that we've made it to the finals in. So stay tuned. You'll want to hear about that and what that means for Morton Hospital. Stay with us, and we will be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
If you're looking for weight loss that lasts, look no further than the Steward Center for Weight Control at Morton Hospital. Our program was recently nationally accredited, and we offer both medical and surgical weight loss options, as well as free support programs, all right here in Taunton. If you've struggled to lose weight, it may be time to consider weight loss surgery. Call our Center for Weight Control at 508-301-2434 to book a consultation.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning. Welcome back to the final segment of today's Morton in the Morning show. Earlier, we spoke with Liliana Pavao and Carla Fogaren of our interpreter services and diversity, equity, inclusion teams here at Morton Hospital. We were so happy to hear from them about the very important work that they do here at Morton Hospital with our incredible interpreter services team. They are just so passionate about our patients, and we are grateful to have them. So hopefully you enjoyed chatting with Liliana and Carla as much as I did. To end today's show, I just want to share a few announcements. Earlier, I mentioned going to our website to find out some more information about our interpreter services program. And if you do, you'll notice that our website looks a little bit differently if you visited a couple weeks ago. So we have redesigned our website to make it a bit more user-friendly and simpler for our patients and those out there in the community to find the information that you're looking for on our website. We've also made it more user-friendly if you're looking at our website on your mobile phone. So the formatting has been updated to make sure that you have a great experience and that you can find the information that you need. And again, our website is mortonhospital.org. Go ahead and check it out and see the new look and feel of our website. Hopefully you like it. So the great news that I referenced earlier before the break was that we have made it to the finals in a very special contest. And that contest is the 2021 Best of the Best Community Choice Awards. So this is either the third or fourth year that this contest has been run. And we are so happy that once again, Morton Hospital has made it to the finals in the Best Hospital category. And that is for the Metro South region. And not only did we make it to the finals and make the top 5 in the best hospitals category for our region, we've also made it to the top 5 in 4 other categories, which we are very excited about because that is new for us this year. So thank you to everyone out there in the community who nominated us in these categories. So those categories are the audiologist category, the hearing aid center category, so shout out to our speech, hearing, and language center up at Northwoods Medical Center. We've also made it to the top finals in the physical therapy category. So again, another one of our departments up at Northwoods Medical Center, our outpatient rehab services department. Great team. They have made it to the finals in that category. And the last category is Weight Loss Center. Now that is one that we are very proud of because our Center for Weight Control was recently nationally accredited as a Center of Excellence for bariatric surgery and weight loss programs. So we are so happy to have made it to the finals for that category as well. Again, thank you to everyone who nominated us in those categories. The next step will be the voting period. And that will take place from August 13th through August 31st. So basically what happens is people log in, they can go to the Taunton Gazette website or the Brockton Enterprise website and search for the contest page and look for Best of the Best. There'll be various categories, but if you go to the locations or the healthcare section, then you can find all of those categories and you can see the list of finalists and you can vote for us in each of those categories. Our name will be listed there. So we will keep everyone posted when the voting starts. Again, it doesn't start until August 13th, but we are so excited to have made it to the finals, and we thank our community for nominating us, and we hope we can also count on your vote when it comes time to vote for the Best of the Best finalists. And a couple updates about some things that have been happening here at Morton Hospital. So we love to celebrate our staff. One of the fun things that we've been doing here at Morton Hospital is we've been doing Fun Fridays for the summer. So every Friday is either a theme dress day where departments can compete and show their pride in various themed categories, and they can win prizes like pizza parties or ice cream parties. So it's either a theme day or a treat day. So if you've been following our Facebook page, you have seen the awesome pictures of our team dressed up for the various theme days. So most recently we did Favorite Decade Day. Even our hospital leadership team dressed up, and we were all in 80s attire, which was pretty funny. We got some great laughs from our staff. But we had a lot of participants for that category. We've also done a vacation day theme, a Christmas in July theme, and we have some great ones coming up. But this Friday, we are excited to do just a treat day for our staff, just to thank them for all of their incredible work and to have a special treat in the middle of the summer. We're having an ice cream sundae day. So hopefully that will be good timing. Hopefully it's another beautiful day and our staff will enjoy some ice cream sundaes this Friday. As far as specialists, we, as I mentioned in last week's show, have welcomed 2 new mid-level providers. One is Amber Lippa. She's a physician assistant who has joined our Steward Digestive Disease Center of Taunton office, and she's joined Dr. Alexis Pappas, who's our gastroenterology specialist, the new specialist with Steward Medical Group. So we now have 2 providers in that office who are treating a variety of GI issues. If you want to learn more about that office, or if you're experiencing any GI issues yourself, you can call to request an appointment. They are located in the Thayer building at Morton Hospital, right up in Suite 2200, so very convenient access from the hospital. And their phone number is 508-828-7740. Again, that's 508-828-7740, and that is our Steward Digestive Disease Center of Taunton. Our Steward Medical Group, SMG Orthopedics and Sports Medicine office up at Northwoods Medical Center also has some changes. So they have been located up in the Northwoods Medical Center building for several months now, but they just moved to a new suite. So they are no longer in the basement of that building. They are now up in Suite 100 at 2007 Bay Street, which is Northwoods Medical Center. And they too have expanded their team. So providers there, Dr. Mark Adams, Dr. Christopher Naka, and Dr. Matthew Werger, they have also welcomed a new physician assistant. And her name is Veronica Walzak, and she just joined within the last couple of weeks. And we are very fortunate to have her. She is now accepting new patients at that office. For more information about our Orthopedics and Sports Medicine office, or to request an appointment, give them a call at 774-409-2009. Again, that's 774-409-2009. And again, they are located up at Northwoods Medical Center. And then lastly, we wanted to share some information about a great community event coming up, which will be hosted by the Taunton Opiate Task Force. They are hosting an Overdose Awareness Day event on Monday, August 30th at Liberty and Union Park in downtown Taunton. It starts at 5 p.m. and they will have a variety of speakers. They will have resource tables. They'll have waters. They're doing a special memorial slideshow. So if you would like to submit a photo to help remember someone that you have lost, that has lost their battle with addiction, you can submit a photo along with their sunrise and sunset dates to be included in the memorial slideshow, and you can email that to csstone@sstar.org. That's csstone@sstar.org. So when you do submit a photo, you do just have to write a line in that email that states that you have permission to send the person's images and that they can be used in the slideshow. So that sounds like it's going to be a really nice event. It's actually the day before International Overdose Awareness Day, which is held annually on August 31st. So great timing for this event. The Taunton Opiate Task Force is such an incredible organization with so much representation from our community, doing great work. We will also be participating at that event. We will have a resource table, a Morton Hospital resource table, and we'll also have someone speaking about our new substance use disorder treatment unit that is opening here at the hospital later in the fall. So we look forward to sharing that information and participating in this incredible community event. Again, to find out more, just look up the Taunton Opiate Task Force, and they will have information about this event on their website and their Facebook page. So that wraps up today's Morton in the Morning show. We want to thank you so much for joining us. Just a reminder, we are on every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. If you have any topics that you'd like us to discuss on future shows, any areas of concern, health and wellness topics that you want to hear more about, please give us an email. Send us an email at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. In the next couple of weeks, we have a great show coming to you. We'll be interviewing a couple members of our audiology team. So again, that team that was just nominated in those 2 Best of the Best Community Choice Awards categories. So we look forward to talking with them about that and hearing how they feel about making it to the finals in those categories. There's a great team up there, so we'll look forward to speaking with them in the coming weeks. So we hope you enjoyed today's show, and we hope you will continue to join us in listening to Morton in the Morning. Thank you so much for listening, and have a happy and healthy day from all of us here at Morton Hospital. Experiencing gastrointestinal issues? We can help. Morton Hospital and Steward Medical Group have opened the new Steward Digestive Disease Center of Taunton. Dr. Alexis Pappas and physician assistant Amber Lippa specialize in treating a wide range of GI issues and are now accepting new patients in their office conveniently located in the Thayer Building at Morton Hospital. To request an appointment, call 508-828-7740.